Hey guys, in today's video, we're going to be talking about 5 perks of using Differin Gel. Differin Gel is the brand name for an FDA-approved acne treatment, adapalene. Adapalene is a retinoid, and it works for acne because it helps improve how the cells behave that line your pore. It loves to get in the pore and train those cells to behave better so that they stop plugging up your pore. Therefore, adapalene helps to stop blackhead and whitehead formation and the red inflamed bumps of acne. But adapalene as a retinoid has other things to offer your skin above and beyond simply clearing up and preventing acne breakouts. On this channel, I have a lot of videos on different retinoids, including tretinoin, tazarotene, trifarotene. So check those out if you are interested. But a question I get a fair amount is like, how does adapalene really stand out from some of these others? Adapalene is unique in that it is a synthetic retinoid. It loves the oil gland. It's lipophilic. And in contrast to tretinoin, the older retinoid, adapalene is a lot more stable. It's so much more stable than tretinoin that it doesn't degrade in light, and it also is stable in the presence of benzoyl peroxide. Another thing that people don't realize about adapalene is that it is anti-inflammatory. It's thought that maybe the anti-inflammatory effects of adapalene are one of the other reasons underscoring its benefits, in that, in contrast to many other retinoids, it's typically very well tolerated. A lot less irritating, a lot less drying. That's not to say that dryness and irritation don't happen, but it is much easier for most people to tolerate adapalene in comparison to tretinoin or tazarotene. Now that you know a little bit about Differin Gel, aka adapalene, what are some other perks above and beyond acne for utilizing this FDA-approved acne treatment? Well, probably the best perk in my mind, and one you may not appreciate, is that it helps to improve post-inflammatory hyperpigmentation. This is an issue especially for people who have a deeper skin tone. Anytime there is inflammation in the skin or skin injury, the skin can heal with a dark mark that takes a long time to fade away. Skin injury or inflammation can be secondary to acne itself or to other skin issues, or maybe you got a bug bite that you picked and scratched. In contrast to other types of hyperpigmentation like sunspots or melasma that primarily happen on areas of the body that are exposed to a lot of sun, post-inflammatory hyperpigmentation can pretty much happen anywhere. On your arms, your legs, where the sun doesn't shine. If there's inflammation there and you have a deeper skin tone, it can heal with hyperpigmentation. That hyperpigmentation can go away, but in order for it to go away, a few things need to happen. First of all, the underlying cause of the inflammation or skin injury needs to be controlled or eliminated. So in the case of acne that heals with post-inflammatory hyperpigmentation, if you are continuing to have acne breakouts, your acne is not under good control, it's going to continue to drive that post-inflammatory hyperpigmentation, and anything that you are trying to do outside of acne treatment to control the pigment, it's gonna just take a backseat. It's kind of like, trying to take a towel to wipe up a wet floor when you have a leak in the roof. You can keep wiping the floor, but it's raining outside and water is just gonna keep pouring on in. So you're kind of, taking one step forward and like 90 steps back. So with acne, you gotta get the acne under control. Once it's under control, then it becomes a lot easier to focus on the post-inflammatory hyperpigmentation. But that's not to say that you can't kill two birds with one stone, and adapalene, aka Differin, kind of does that. It's an FDA-approved acne treatment, so it's going to help clear up, control, and prevent breakouts. And so we're addressing the leak in the roof. But adapalene also can help to get rid of hyperpigmentation. It does this for a few reasons. One is it helps to improve the rate at which the skin cells turn over. And so what that's going to do is any pigment that is up in the top layers of the skin is going to clear out a lot faster. Adapalene can also suppress some of the negative impacts of ultraviolet radiation on hyperpigmentation. Adapalene also is anti-inflammatory. and because of that, it helps to mitigate some of the drive for more pigment production. Now, one thing you have to keep in mind when it comes to post-inflammatory hyperpigmentation is that anything that causes your skin irritation can worsen the hyperpigmentation. So if you don't tolerate adapalene, if it's irritating to your skin, then that can actually worsen the post-inflammatory hyperpigmentation. That being said, of all of the retinoids, adapalene is one of the most well tolerated. We talked a lot about acne. It's an acne treatment, but it also may be helpful for improving post-inflammatory hyperpigmentation from like a bug bite that you had, provided that you're not continuously scratching the bug bite, because that scratching, it leads to more inflammation that drives more hyperpigmentation. It may help clear that up faster. The number 2 perk of adapalene that people don't realize is it actually can help improve age spots. Age spots caused by sun exposure. The medical term for these are solar lentigines. Solar lentigines happen in areas where you have had a lot of sun exposure, especially if you have a skin type that is, more sensitive to the sun, paler skin type. They can happen on the face, the chest, the neck, the backs of the hands, the backs of the arms. They also can happen on the lower legs. Adapalene can help lighten these. It won't necessarily erase them, but it can lighten them. It may take some time. You may start to appreciate it around 4 months, but by 9 months, if you compare older photographs, you may say, hey, my sunspots were a lot darker back then. Adapalene definitely can help to lighten those. We think of it's an acne treatment, so a lot of people are using it on their face. But I always point out, if you've got age spots on the back of your hands, adapalene can help lighten those and can be used here. Also, on your forearms. Speaking of things related to the sun, adapalene may also help to improve sun damage, specifically a skin lesion that happens in areas of extensive sun exposure and sun damage that is actually a precursor for skin cancers. It's called an actinic keratosis. These little rough, scaly spots. At a very slow rate, they can actually turn into a squamous cell skin cancer. So we treat them by liquid nitrogen or other measures. But patients who make a lot of these, who have a lot of sun damage, they've gotten a lot of cumulative sun exposure throughout their lifetime, we know that actually adapalene, similar to other retinoids, can actually reduce the number of these that people form. And part of the reason for that is that retinoids, they help improve sort of the behavior and the orientation of cells in your epidermis. They kind of just, exert, and you can think of it almost as exerting some sort of, chaperone effect, a disciplinary effect, if you will, on the unruly keratinocytes of the epidermis who have been, damaged by the bad influence of UV. Adapalene and other retinoids can kind of help to, correct some of that to a certain extent. And as a result, people who make a lot of these actinic keratoses, they make fewer of them when they use a retinoid. Now, as soon as you stop the retinoid, then you can go on to make as many of these as you would have had you never used it. But that is definitely a benefit of retinoids, including adapalene. Perk number 4 applies to a group of you who probably have been ignoring retinoids because you're told that you can't use them. And that is adapalene, as well as other retinoids, but adapalene in particular, can actually be beneficial for people with rosacea. I know, shocker. I say shocker because rosacea people have very sensitive skin, and a lot of their symptoms, their skin findings are aggravated by things that are irritating to the skin. And retinoids, we know, have a bad reputation for being irritating, for burning and stinging. As I said, adapalene is one of the least irritating retinoids, but it can still be irritating for people who have rosacea. However, if you are able to tolerate it, if you're able to introduce it into your routine slowly, get used to it, and incorporate it into your routine, what it can do is it actually can help cut down on the number of papules and pustules. These are bumps on the skin of people who have rosacea that are red and or filled with pus. Now, adapalene can help cut down on the number of those, possibly through a few mechanisms. One, maybe through its anti-inflammatory effects. Two, maybe it helps by normalizing the epidermis to a certain extent, cut down on sort of the food and fodder, if you will, for that little mite, Demodex. Demodex mites are, naturally present on everyone's skin, but for people who have rosacea, they have a lot more of them in areas of their skin that have these little bumps. It's thought that with rosacea, people with rosacea have an abnormal inflammatory response to either that mite or to little bacteria that live on the mite. And so a lot of topical rosacea treatments we are thinking may actually work by cutting down on the burden of that mite or addressing the bacteria that live on that mite. So retinoids can actually help to a certain extent with that. And they definitely have been shown to cut down on the number of papules and pustules. Now, the other component of rosacea is a background of redness. Erythema is a medical term for redness. Looks like a flush. Initially, you get bouts of flushing that come and go, and then as your rosacea becomes a chronic thing that you deal with time, that redness can become more persistent. The other aspect is with rosacea you get dilated blood vessels. They're called telangiectasias. Adapalene is not going to treat or get rid of the persistent redness or the telangiectasias, but it can help with the bumps and the pus bumps for short, provided you tolerate it. Check out my video on retinoid for sensitive skin. I give a lot of tips on how to introduce retinoid, including adapalene, into your routine very slowly and conservatively so that you have a chance of using it if you have very sensitive skin. I also have a video all about short contact therapy as a way to slowly introduce something like adapalene. So check that video out. I'll link it in the description box. But that is another situation where you might actually be surprised to find that if you tolerate it, then your rosacea actually can improve. And I find men with rosacea are a group that may actually tolerate this a little bit better. Men have thicker skin, they have larger oil glands, and again, adapalene loves to get in the oil gland. So if you're a man out there who has rosacea and you're getting those bumps that look like acne, it's not true acne, but it's the bumps of rosacea. Adapalene may help if you're able to tolerate it, if it doesn't burn or sting. And then the fifth issue that adapalene definitely can improve are sebaceous filaments. Now, sebaceous filaments are something that people who have oily skin tend to notice. We all make them. They're not harmful. They're not, dangerous. They're not an indication that you have bad hygiene, but rather they're just like a little extrusion of kind of almost dried up oil plus dead skin cells. And they tend to be more noticeable in people who have oily skin and are prone to blackheads and whiteheads, which, as a reminder, are part of acne. But using a retinoid can actually help cut down on the formation of those as well, because it's helping to kind of normalize the pore lining. So there's less sticky stuff in the pore for it to then extrude and be visible to your eye. All right, y'all. So those are 5 perks of using adapalene. There are many others, but those are just skimming the surface of 5 things so that you better understand that it's not just an acne treatment, although that's what it's FDA approved for and that's what all the research supports its use for. But there are some added side perks to this acne treatment that hopefully you have a better understanding of from this video. Now, should you just use adapalene willy-nilly in the hopes of helping your skin out? No, I wouldn't suggest that. But you may be interested in it for some of these things that I mentioned here, especially if you have acne that heals with hyperpigmentation. Adapalene, which is the active drug in Differin Gel, it's been around since 1996. So it's a newer retinoid, but that to me that seems like yesterday, but it was quite a while ago. So it's been around a while. Adapalene, it loves the oil gland, but it is not significantly absorbed into the body. In fact, people who use adapalene chronically, when their plasma is sampled, they have trace to negligible amounts of adapalene components, metabolites, on the order of 1/4 of a nanogram, which is hardly anything, per milliliter. So that being said, it can still be detected. So theoretically, there is a risk if used during pregnancy. There's a theoretical risk that it could be harmful to the developing baby because it is a retinoid, and retinoids that you take by mouth, like isotretinoin, those are incredibly harmful to the developing baby. I mean, it leads to birth defects that are not compatible with life. And so because of that, we always caution against using the topical retinoids that you put on your skin while pregnant. Now, a couple of months ago, I actually did a video all about retinol in pregnancy. I talked there about how, the absorption is pretty low. So watch that one. But all that to say, it appears as though, even though it's a theoretical risk that adapalene, because it's a retinoid, if used during pregnancy, could cause harm to the developing baby, they've actually done studies in animal models, in lab animals, where they used 100 to 200 times the amount of adapalene that would ever be used on human skin. And there were no birth defects in these animal models. There are no reports of anyone having birth defects from adapalene, but all that to say, out of an abundance of caution, we of course tell women to not use adapalene during pregnancy. All right, y'all, so I hope this video was informative and giving you a little bit more information about some of the other things that adapalene might offer. Now, on the end slate, I'm going to link my recent video talking all about adapalene for anti-aging. We kind of touched on it here, but in that video, I do more of a comparison between adapalene and tretinoin. So you're going to want to watch that one next, especially if you are interested in adapalene for, improving the signs of skin aging. But if you guys enjoyed this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.